Hi, my fellow friends. Welcome to the program Careers Connect, a DPS-ALUMNI NETWORK presentation. My name is Neelam Bedi Son. I'm a human resource trainer. I'm into industry from last 20 years, and I have my working presence in Delhi and Dubai. The COVID-19 pandemic has reached almost every country in the world. Its violent spread has left all global economies and businesses counting the cost, as government all over are struggling with the new lockdown measures to tackle the spread of the virus and save the economic wealth. Global coordination and cooperation are witnessed, and the new challenges are seen both at economic and educational front. Online education has become a new normal protocol, and the students at large are facing the dilemma of uncertainty and unstable study infrastructures, which are overtaxing and confusing. Here, we at Careers Connect help students make an informed choice by facilitating their interaction with top-notch professionals in over 500 careers. The aim and objective of this show is to connect professional genius from all national and international forums, exhibit their success stories and their struggles, the sacrifices they made at different times, circumstances, and environment, and finally reaching heights to what they are today. Now I invite Mr. Rajiv Soni, the man behind this program, to say a few words.
Good evening, everybody. Thank you very much. So Careers Connect started in 2014. That's good 7 years ago. And it was when a premium school in Delhi, NCR, had invited me to speak on various professions. But I can only speak on two, chartered accountancy and the other is information technology. But they wanted me to speak on a host of others also, which I found a little taxing and unfair also on the students. So I invited 25 of my friends, all from DPS, who were at the helm of their professions. And they all came into this particular school in the morning at 8 o'clock. And for the next 3 hours, we broke 600 kids of 11th and 12th into these 25 different professions. And we also beamed in 5 people from overseas, way back in 2014.
Wow.
So that then gave an idea that we can have more than 5 or 10 or even 15 people at any one given point of time. So that is how Careers Connect has evolved. So today we are able to connect with these professionals in different parts of the world, as well as probably in Gurgaon or in Delhi. And today we have a very high achiever, a medical professional who's with us, and I hand the mic back to Neelamji to take this show forward. Thank you very much.
Thank you so much, Rajiv. Today we have with us Dr. Chand Rohatgi, a real handsome, dynamic, versatile, and a medical genius. A man who does not lose hope and believes that when the sun comes down, the stars are out. A Dipsite 1977 batch who made us really proud. MBBS and Masters in Surgery from All India Institute of Medical Sciences, Banaras Hindu University, Varanasi, India. He did his surgical residency in SSL Hospital, Varanasi, India. Rotating internship in surgery, medicine, gynae, preventative social medicine, SSL Hospital. Migrated to America in the year 1987, where he studied and passed ECFMG exam. He further specialized in his general surgery residency, Easton Hospital, Pennsylvania. Monmouth Medical Center, Jersey Shore Medical Center, Long Branch, New Jersey. Surgical Observership, Easton Hospital, Pennsylvania. Dr. Chand is a breast cancer and a general surgeon with Coordinated Health, part of Lehigh Valley Health Network. He oversees the comprehensive management of breast diseases with specialized training and expertise in cancer treatment. His specialties include biopsies, stereotactics, genetics, genomics, and advances in radiation. He has his expertise in cancer surgery and has great name in the state of Pennsylvania, USA. He is a medical director, cancer program, Easton Hospital, PA, medical director, Palliative Care Program, Easton Hospital, PA. Site Clerkship Director, Surgery, Dr. Excel, U College of Medicine, Easton Hospital, PA. He has been facilitated and honored with awards from time to time. Dean Special Award for Excellence in Clinical Teaching, Dr. Excel University College of Medicine, MCP, Henman School of Medicine, Commission on Cancer Award 2009, 2006 American Cancer Society Award, St. George National Award 2014, Eastern Avenue. He is also an assistant clinical professor with Dr. D. Sales University, Allentown, and held general surgery at Premium Hospital in USA, PA. Easton Hospital, Easton, PA, Lehigh Valley Health Network, Allentown, St. Luke's University Hospital Network, Bethlehem, PA, St. Luke's University Hospital Network, Warren, Pittsburgh, New Jersey. The Center for Specialized Surgery, Bethlehem, Blue Mountains Health System, Lehighton, and American Board of Surgery. He's the Vice President of American Cancer Society Division Board. He's also closely associated with Community Service, Tracy Elementary School, Easton, PA. He coaches and conducts lectures for third-year medical students on various verticals like breast diseases, benign and malignant tumors, ethics, surgical record keeping, pre and post-operative patient care, bedside rounds, oral exam review, and preparation. In the field of medicine in America, he's called the cancer warrior. Let's welcome today Dr. Chand Rohatgi. Welcome, sir, on board.
Thank you, Neelam. Thank you, Rajiv, and Carriers Connect and the DPS Alumni Society. Thanks for that very, very kind introduction. I hope I can help the students looking forward to this meeting achieve greater heights.
Thank you very much, Dr. Chand, for coming. And
I've been practicing in Lehigh Valley for 21 years now. So when I started, training was from head to toe. Today, at Coordinated, 80% of what I do is concerned with breast diseases. In the field of breast, there have been a lot of advances made in the last 2 decades, which really attracted me. Most of us worry about breast cancer, but in reality, 80% of breast diseases do not entail the diagnosis of breast cancer. Looking at Coordinated, I found them to be patient-centered and interested in the physician well-being and providing me all the tools that I need to do the best for my patients. I do like to give back to the community, and I have been an active member of the State Theater Board and also the American Cancer Society at the national level as well. The reason the patients should come to me is once they are here, I devote my 100% to them, and I will guide them through their journey of the surgery and the other treatments if needed.
Okay. Dr. Chand, you left school in 1977 and you joined medicine. Can you tell us your journey, why you chose this profession?
Well, very interesting. In India, we choose our disciplines right in the 9th grade.
Correct.
And I want to mention that because in America, the graduate college, you can do arts and still go into medicine.
Correct, correct.
So when I was in 9th grade, I asked my parents, as we all do, I want to go into accounts.
Oh.
Yes, and my father said, why don't you go and take biology for now and all the lines will be still open for you.
Wow.
So I stayed that way. And I don't know if you remember, 1977 was the last batch of higher secondary, the 11th grade.
Correct.
We had to go into college. So again, going into college, I asked my parents again, can I go to Sri Ram College?
Wow.
Go into and become a chartered accountant. And my dad said again, you know what, just try medicine. Getting into medicine is tough, but once you are there, you are kind of assured of success.
Wow.
And once I got into pre-medical, I was at Hindu College. There was no looking back.
Wow.
In my mind, the image of a physician was going into the operating room in the middle of the night, take the appendix out, and make the patient all better. And that's what I carried with me throughout.
Beautiful.
So, and that what took me to Banaras Hindu University in my endeavor to appear at an entrance exam for a medical school, which is of a national standard.
Correct.
Once I was there, I realized in medicine again, that image stayed with me of a physician being a surgeon. And throughout my 5 years of medical school, it just consolidated in my mind that I had to be a surgeon. And towards that goal, I pursued my Master of Surgery in BHU itself.
Wow.
And if I had stayed one more year, I would have gone into my favorite field, which is pediatric surgery.
Oh, wow.
Yes, but I let go of it because an opportunity came to come to America. And once I was here, my residency journey started again and took me towards cancer and towards breast, where I am right now.
Correct, correct, correct. I think, Chand, staying after 77 to 87, you were in India. I mean, you were in Varanasi, right? And you were having a good, you were actually qualified enough to be there. But what made you leave India and go to America? And what was the struggle there? Because, every time when you go abroad, you have to take the exams, and there's a great struggle, establishing yourself there.
Yes. So it was not easy. My older brother, who is a graduate of Ames, Delhi, had come to America, and again, a dip site, 10 years prior to me. And my parents had come here, seen his lifestyle, and they wanted me as well to come to America.
Correct.
I was not that keen initially because, like you said, I was getting my master's in surgery. Correct. I had passed it. I was going to start my favorite subject, subspecialty. And my parents pursued me to chase that journey.
Oh.
And I did come here, but it was not all roses. I stayed with my brother and my sister-in-law, who took care of me as my parents would.
Wow.
And I stayed with them for 2 years, doing my exams. In those days, remember, we had no internet.
Yeah.
And we had no idea of what kind of exams I will have to do here. Today, it is much different. Every medicine graduate, actually anybody in India, can know what is required in these exams here. So once I came here, I was so shocked. There was a culture shock. The first thing I remember, actually, my brother had come to pick me up at the airport, and my sister-in-law went into the back seat, and I was in the front seat. And he says, put your seatbelt on. Oh, what's that? And lo and behold, I could not pull up my seat belt. It was getting stuck. And I said, oh my gosh, the inferiority complex set in at that time. And my brother had to help me tying the seat belt.
Wow.
And again, many of these such little things which bothered me. Obviously, they are of no consequence, but it does shake your inners for a little bit.
It does.
But I was determined that I had to do it. I spent 2 years passing all those exams. And then the next step was getting a residency.
Oh, yes.
In those days, surgery residency was so coveted that the competition was fierce, even among the American medical graduates.
Correct.
So to think of having a foreign graduate take up a surgery spot was unknown. And I had to repeat my surgery residency. So so surgery residency in India is 3 years, but in America it's 5 years.
Oh my God.
And that 5 years turned into 8 years for me because of being a foreign graduate.
Oh,
But in surgery, you learn by doing things.
correct.
And I think that's what really helped me with my background in actual surgery from India. My mentors could see that I can accomplish much more technical procedures than their American counterparts.
Wow.
So that really helped me, and I did not waste any time. These senior surgeons would leave all the case to me as a resident to
Wow.
finish it up.
Hmm.
And that really boosted my confidence in myself. And that is why I chose not to do a fellowship, because I was, again, advancing in age by this time.
Correct.
And by my experience in Banaras with the cancer and hair as well, in my 5 years, I just got very close to a accomplished cancer surgeon. And he was the one who laid the foundation for me being in the cancer field.
Wow.
And he had a special interest in breast, and I could see myself in that position. So I sought those avenues of accomplishing myself, advancing my expertise, education, seminars, workshop, and I pursued it relentlessly. And that is why I was able to reach this point.
Brilliant, brilliant. I think your advice to our students, you see, there's nothing, more than doing hard work. I think that's a lesson to all our children. Seeing your life, like, you were almost settled here. Again, you went to America, and again rebooted yourself. And today, whatever you are, it's all because of your continuous struggle.
Yes, indeed. And I think we have to chase our dreams.
Correct.
And dreams have to turn into a vision, and it has to be accompanied by hard work, no matter what.
Correct.
And the dogged pursuit of that, whatever it needs. I knew I don't have a fellowship training, so I need to stand out in some ways. And that's what I did. I pursued other avenues to make myself ahead in the breast field.
Wow.
If I would hear about any cutting edge technology, I would go for it much earlier than my American counterparts would.
Wow.
And slowly and slowly, they realized that this person, even though may not have formal training,
Yeah.
but is equally and maybe even better qualified
Wow.
to take care of patients.
Wow. Wow. Brilliant. Brilliant. So you're primarily on breast care, offering additional surgical services in general surgery, laparoscopic surgery, surgical oncology, and colorectal surgery. Can you tell us how you have engulfed these diverse fields of knowledge?
So in America, just like in India, the residency trains you in almost every aspect of surgery. And I got my certificate as a general surgeon, but again, the interest was in the cancer and the breast, but still taking care of the students and the residents, I had to pursue all of them. And I knew the robotic surgery was coming in.
Correct.
And I made myself again out there to make sure that I'm able to train my junior and future surgeons
Wow.
to the best of the technology which is available. But as I have grown in my stature as a general surgeon and in the life, I have chosen to just do breast diseases itself. There are around 250,000 breast cancer cases in America
Yeah.
per year.
True. True.
So there's a lot of awareness, and there's so much advancement being made in this field that just drew me into it. And although I still dabble in general surgery because I have to by demand, but my primary pursuit is in breast field.
Very nice, brilliant. Okay, you have an outstanding record, in US about your work. How do you think you can inspire the children to come up to that level?
Like we already said, we do need to work hard at it. We need an attitude that we can do it.
Correct.
And it has to be added along with the aptitude. We cannot just sit and assume that we will get there and somebody will get us there.
True.
Yes, you need that push. You need a mentor, you need a well-wisher, but it is still up to you to get there and achieve it.
True.
And in adversity, I think all of us shine somehow.
True.
It should be taken as a challenge, as an opportunity, rather than succumbing to it and not doing anything.
True. Any special traits, Dr. Chand, you feel a student should have to join this profession of medicine?
Like in any profession, we have to work hard, but what takes you into medicine and into the depth of it is you have to listen to the patient.
Correct.
You have to listen to their story.
Correct.
And you have to be empathetic
Empathetic.
towards their disease process.
Correct.
To help them through their journey. That is so important. And I think that is something which may separate this profession in India versus America. You cannot get away from it here. That is for sure.
Correct.
And as soon as I realized it, I saw that I become the favorite choice for their family, for their friends, and the other referring doctors.
Correct. And I feel, the emotional connect is very important for a doctor to have, with the patient. Very important, because he or she heals faster if there's an emotional bonding.
Definitely. And, initially we are struggling to just learn the subject, and we may not be able to show much of that quality. But as we mature in our profession, that is a very outstanding trait. If you, even as a resident, even as a student, as a trainee, if you can take that patient, assume that you are in control of that patient completely, there's nobody behind you.
So sweet.
Then only you will take up that responsibility.
True.
Very important.
True. Can you recollect these 25 years of your being in this profession? Any favorite memory you have?
So, after all that struggle, I finally got into a track where I knew I will graduate and become an accomplished surgeon here.
Okay.
I was a resident, and there was this patient who just connected with me. And I was only a resident, but I connected with him. He had thyroid cancer. And he has had a few episodes and recurrences. And here he was at another episode of recurrence of thyroid cancer. And I was persuading him to continue with his treatment, which would have been very good. And I was graduating at this time, and I did not know what I was doing. Will I do a fellowship? Will I start my private practice? This patient told me at his bedside, "Doc, I know where you are going."
Wow.
And this patient knew, because my mentor, who was taking care of him, had mentioned to him that he wanted me in his practice as a partner.
Wow.
I did not know that. So that still to date has been my favorite moment.
Wow. See, these are fond memories which you can never, never, ever forget.
Yes. And I think those patient testimonials,
Very important.
that is what propels me further to do more for my patients.
Correct.
And that is something which is unique
Correct.
to this profession. Yes, you have to have that in everything you do, but you really have to make that bond with that patient.
True.
And
Very
you have to
important.
make them understand, yes.
Okay, Dr. Chan, can you tell me your greatest accomplishments as a breast cancer surgeon?
Oh, wow. Just being sought after by the patients and colleagues is really I think the true sign of being recognized. And I think
True.
that's what I would call my accomplishment.
True. That connectivity, that touch, that care, that is the most important thing, I think. Proper
Yes.
coordination also, very important.
Very, very well said. Yes.
Yeah,
Yes.
yeah.
And
Okay, tell me, Dr. Chand, are you satisfied with the material gains you earned in your profession? Was it lucrative?
oh, definitely. But in my mind, I never did those things for material gain. I pursued my profession and to do my best. And I think the money follows.
Correct.
Medical profession anywhere is very well respected, and it makes you lead a very successful and a satisfied life. That is very important.
Correct.
The pursuit of material gain is important at some stage of life, but if you do the right thing, money will follow, and success and fame will follow.
True. Okay, Dr. Chan, tell me, 3 decades back, how did you think of getting into cancer surgery? That time cancer was not that prevalent. People didn't have much, but today it has become a massive, disease. So how did you get into, what made you get into this line?
In Banaras, I had a few surgeon mentors who were excellent in cancer care. And in Banaras, there was a lot of head and neck cancer because of tobacco chewing and pan, a lot of tongue cancer, a lot of oral cancer.
Correct.
So those surgeon mentors had already planted a seed in my mind. And when I came to America, again, one of my mentors here was a cancer surgeon. And I could see him work, and I was fascinated by, yes, some of our patients will still die. I would say around 25% of them will still die at some point of their life.
True.
Because of the disease. But we are making progress in this field, leaps and bounds. More and more surgical techniques are being developed. Technology is helping us.
Correct.
And the medications and chemotherapy methods are becoming more successful and more humane.
True.
So that is what has made me go into this field, although some of them will have not such good results.
Yeah,
but we can make a lot of people better and prolong their lives.
Yeah.
Have a successful life.
Correct. Okay, given the way technology is racing ahead with AI and virtual reality, what changes do you foresee in your line?
Well, you said it right. The mammogram in breast cancer field has become so important.
So
We
important.
started using mammograms around 45 years ago, and they have helped us a lot.
Correct.
And then we came from film radiography to digital mammography. And today we can use artificial intelligence to even predict by looking at your prior 2-3 year mammograms, whether you
have
will
it.
develop cancer or
Correct.
not.
Correct. Correct.
And all the technology which we are learning can be put to good use. Our same instruments are becoming better.
True.
We can handle them better. And also, once I do the surgery, the next part is chemotherapy, and that is also advanced. We are able to prolong life and successful life for a long time now. And even in the field of radiation, the radiation field has become kinder and gentler with very good results. So all those things, I think maybe not in the next decade, but definitely in the next few decades, we may not have to do any disfiguring surgery for breast cancer.
Wow.
We will have, yes, we will have so many good tools.
Wow.
And anybody looking into joining this field really needs to put their eyes out for the progress and for the advancement.
Impeccable, impeccable. Okay, Dr. Chan, tell me about your missionary work you did in South Africa.
Oh, that was such a remembrance. So as you had mentioned, one part of the cancer field is palliative care and hospice care. And like I was saying, some of our patients will end up there, no matter what. But it is my duty to let them pass that time in dignity with their family members close by. And one of the agencies I was associated with, they realized that there's a lot of work to be done in South Africa. Believe it or not, in Cape Town,
wow,
there are still colonies which are kind of segregated. And I would, almost similar to our slums, that in a place of where we would live as one family with 5 people, there are 50 people or more. Maybe they not have running water, open sewage, bathrooms. So these kind of places just were needing basic amenities. A lot of TB and a lot of HIV was there. So we worked among those people to see what their needs are. How could we provide them medications, and actually just to educate them that they should seek medical care. Yes, they will get better. And that was an eye-opener for me.
Very challenging.
Yes.
I would say very challenging. My God. Okay. Tell me, Dr. Chand, if you turn the clock back, would you like to again be the surgeon what you are today?
Yes, no doubt. Surgery has been my life, and the more I get into it, the more I enjoy.
Wow.
And the only thing is, if I could combine the American medicine principles back in my town of Banaras or Delhi,
wow,
I would do it in a heartbeat.
Lovely, lovely. That is a beautiful thing you've said. That's the most beautiful thing you've said. Okay, Dr. Chand, last question. Kindly advise to our young children, our students about the profession, and also to our qualified doctors here in India, that what they should do to be the best and the most, specialized doctors.
Well, starting from high school, I think they need to have their dreams. In India, most of us were dictated in our generation by our parents. Yes, that should be still a consideration, but you have to know deep within yourself what is your passion, and you have to follow it.
Correct.
combine it with hard work, and a proper attitude of learning and advancement in any profession you go. But especially in being a doctor, you cannot just go in there for money.
True.
You have to go in for the betterment of the patient body and mind. And I think once you achieve it, nothing is beyond reach, really. And it's not just a cliche, it is heartfelt.
Correct.
And it can be achieved, and you have to want to be there at the top of the profession, and you will get there.
Correct. Thank you so much. And I think you are doing a lot of community work also. You are also teaching the young medical students, counseling them, teaching them, which is another impeccable work you're doing.
And I think that is how I give back to my community, my society, whatever I can do for them. During the COVID months, actually, I delivered meals to the families who could not afford and could not go out.
Wow.
In COVID months, we learned a lot about ourselves because we were not able to do medicine or surgery, but we were able to do so many other things. I started enjoying my garden.
Wow.
And I was planting things. I was doing physical work of digging and paving, which I had never done before.
Beautiful.
But you have to let that part of your personality also shine.
Yeah.
Very important.
Thank you very much, Dr. Chand, for coming. It has been a pleasure. Now, a little appreciation package for you. Dr. Chand, curing life-threatening cancer patients have been your profession for almost 4 decades, and still you strongly believe in when you get to the end of your rope, tie a knot and hang on. That is what is your motto in life. You've been a fighter and always find time for things that make you feel happy and to be alive. Thank you very much. I think it is commendable hearing all your success story. Now over to Rajiv, if he has any questions.
I have no questions. I'm just amazed at listening to Dr. Chand Rohatgi. All I can say is doctors are angels on earth.
True, true.
Again, for the parents and the students, if they need any advice, you can definitely let them know my contact information.
Thank you.
I would be more than willing to help in any way I can.
Thank you so much, sir.
Thank you so much. Thank you so much, Dr. Chand Rohatgi, for coming and giving your valuable information. Thank you, Rajiv. Thank you, Javed. Thank you, all my fellow friends. Bye-bye. Shabba khair.
Thank you, everybody.
Bye-bye. Thank you once again. Thank you. Bye-bye.
And you and Neelam both have worked so hard on this project, and I could recognize that. And that's why I had to agree. I still remember Neelam with her 2 ponytails.
Pigtails. Let's call them pigtails. Wow.
But I really should commend you and Javed as well. Really, you have spent so much effort in knowing me. And the questions which you have posed are really, really very good. And the way you have put them, I'm really amazed. You have done, and it's not only that 1 hour which we will spend together, but the time you have spent before it.
Yeah.
What about the time that you have spent looking after people at large in this world?
But
Then-
to really drill down into the, you have done a remarkable job, I should tell you. And having these sessions,
Thank you.
I can imagine how much work has gone.